So the first thing I think we're going to do is we're going to start introductions. So we'll kind of introduce some of the state staff that are on the call, and then we'll go into uh, our cohorts over at Alvarez and Marsal, and then we do have a team member from Acumen on the call as well today. So I think I will start first. Kate Anderson, I am the HCBS Operations Manager at the division. I'm located here in Pierre. And so if you guys feel comfortable, please put your name, where you're from, and your role in the chat. That'd be great. But Kate Anderson over at the division, and I will pass it off to Julie.
Hi, everyone. My name is Julie Hand. I am the Assistant Director with the Division of Developmental Disabilities. I will turn it over. I don't know if I've seen our Cabinet Secretary Shawnee join just yet, but so I'll turn it over to Tom, our Deputy Secretary.
Uh, Good afternoon, everyone. Tom Martinez. I'm the Deputy Secretary of the Department of Human Services. And I'll turn it back over to you, Kate, to introduce the rest of the DD staff.
Yep. Carrie Geppert.
Hi, good afternoon. Carrie Geppert. I'm with Division of Developmental Disabilities as a Family Advocacy Coordinator, and I'm based out of Sioux Falls.
All right. I think that should be most of us from over here at the division. I think I'm going to pass it off to A&M or Alvarez and Marsal.
Kate, we have one more. I want to make sure Gus gets to introduce herself because I am guessing there are questions for her throughout. So
sorry, I missed you, Gus.
Oh, that's okay.
Yes, hello, I am Gus Weiss, and I am located in Sioux Falls, and I'm here to kind of answer any questions related to shared living as we move through our presentation today.
Thanks, Gus. Hi, everyone. I'm Erin Levitin. I'm a Managing Director with Alvarez and Marsal Public Sector. You'll hear us call ourselves A&M. Some of you may remember us as the team who recently did the assessment of Family Support 360 and the shared living portion of the Choices waiver. We're really happy to be back in South Dakota, teaming up with the department to help support this transition and some other work. With me today are Brian and Ben, and if you guys would introduce yourselves in that order, please.
Hey everybody, I'm Brian Allen. I'm a director with Alvarez and Marsal. I've been with A&M Public Sector for about 7 years. Very excited to be working with the state and also to be working with you all today. Pleased to be on the phone with you all today. Thank you.
Hi all, I'm Ben. I'm an analyst here with Alvarez and Marsal, and I am also on the day-to-day team, helping out however I can, and it's good to be on with you all today. Thank you for joining.
All right. Thank you guys all so much for introducing yourselves. I think we have one last kind of team member to introduce. Nick Pennington with Acumen would be the next one. I think I've seen him on the call.
Yeah. Hi, everybody. How are you? I'm Nick. I'm with Acumen. I'm here to answer any questions you guys have, shed any light on any Acumen processes, and just try to make this transition as smooth as possible for everybody. So if you have questions for Acumen, today's certainly the day I'm here to answer. I'll do the best I can. If I don't have the answers, I'll go and find out for you and get back to Cade and his team to share with everybody. So thanks for having me. I appreciate it.
Yeah, definitely. Thanks for joining us today, Nick. So this is our third town hall of this week. So the information we are presenting will be the same as the other town halls, but the questions are likely going to be different. So today we're going to share information with you about the changes coming to the Agency with Choice program. We'll share the choices that are available today, and then we'll kind of tell you about what we're working on to create new choices. So we really want to hear your questions and ideas. And we'll also share how you can learn more or how you can partner with us as well. We'll kind of go over some of those things further in the slides. But our goal is to minimize disruption. This is kind of, our main goal for the purpose of these town halls is to minimize disruption for people with intellectual and developmental disabilities and their families. So providing stable and reliable services that meet people's assessed needs. So I think I'm going to turn it over to Erin just to kind of level set on some of the expectations with the meeting.
Sure. Hey, everyone. Erin. I'm from A&M, and just wanting to do a little bit of connecting on where we are at this point in time. Really happy to have you all here to join us today. It's been about a month since the last town hall that DHS hosted. And the idea, as Kate walked through, is really to use this time to share updates with the people the agency supports and family members and hear questions and concerns. There's also a weekly call that's hosted with the family support coordinators where information is being shared weekly. We hope that is and expect that that's being passed on to you as family support coordinators receive it. We know they're a critical support. For this call, we want to make sure that we're prioritizing and having enough time to hear all of the questions and concerns and comments from the people DDD supports and their families, knowing that right after this call, we'll have time with the family support coordinator. So to the extent there's time, we'll take those questions now. If not, we're happy to take them all in the next hour from family support coordinators. What we're gonna do this afternoon is Kate's gonna give you an update on where we are, and he's gonna run through a couple of slides that'll walk through what's happened since the last time we were all together a month ago. During that update, what I'd ask is that you write down any questions you have in the chat as they come up. Let him get through that update, and we will respond to as many questions as we can during this time. We'll also update the frequently asked questions and make sure they get posted on the website. So if they're in the chat, we know we have your question correctly as you asked it. The one thing I want to say is this town hall is not going to be as satisfying as any of us would like it to be. There is not a solution yet in place for agency with choice. What we want to do is really keep you up to date as we partner with DHS to work through this and develop solutions. We want to hear your ideas. We want to keep you informed about what's happening. To the extent it's helpful from my perspective as a former state leader and having been at A&M for the past 5 years working with states on these kinds of projects, it just takes time to solve complex questions like this. There's a lot of things happening behind the scenes that are hard to see as progress. Lots of data analysis, both understanding the numbers and the population, but also understanding what has to be different to create a solution that's sustainable and will last in an ongoing way. Identifying new vendors, doing procurement, sort of given the complexity of the work. I think we all wish we had more answers today, but I believe we're on track given the complexity, and we'll continue to meet with you monthly and update you on where we are and what's changed since you've last talked with us. So with that, Kate, I'll turn it back to you.
Yeah, thanks a lot for that overview, Erin. So I guess one of the first questions we really need to answer is like, what is actually changing? So agency with choice is, just a little background. Agency with choice is one way that people receiving family support 360 services manage their supports. So the agency with choice program is going to change in 2024. So how do you know if this affects your family? If you are a family member, if you or a family member use respite care, companion care, personal care, or supported employment through the Family Support 360 program, and you're not using Acumen to self-direct your services, this is going to affect you. So once again, if you're not using Acumen, and then if you or a family member use respite, companion care, personal care, or supported employment, this is likely going to affect you. So what exactly is the change? So all 5 providers that offer agency with choice services have told the Department of Human Services that they will stop providing these services. So these providers are planning to stop their co-employer services, not other services that they might deliver. So you wouldn't, you're not going to lose your Medicaid. Your family support coordinator will still be there. So it's just those 4 care services, that respite care, companion care, personal care, and supported employment. So kind of what the state is doing, we're definitely exploring ways that will sustain agency with choice in the state long term. So we're exploring new South Dakota vendors, national vendors, and then additional support for the current providers as well. And we're sharing the information as we get it as soon as we can, just trying to be as transparent as possible with it. So kind of there's 5 different agency with choice providers across the state, and they kind of have different end times. So when will your particular agency with choice stop? So LifeQuest will be the soonest on June 30th of 2024. Then Dakota Milestones on December 1st of 2024. Volunteers of America, Lifescape, and some of the individuals at the Center for Independence will end on 12/31 of 2024. And then there's some other employees at the Center for Independence that will end on 5/31 of 2025. So the bottom line is that while we're working hard to prevent disruption, people who use agency with choice may not be able to keep accessing this support. So families should really start planning now. We really do not want to see families wait until the very last minute to try to make a change to maybe to the common law option. So we really want families to be mindful now and to really make really well informed decisions as soon as possible. So these are some of the different strategies we're trying right now. Like I said, our goal is to minimize disruptions as much as we can. So talking to our current agency with choice providers and looking for options together. We're talking with a potential new local South Dakota provider for agency with choice. We're meeting with national agency with choice providers. Then we're exploring whether shared living may be right for some families who use agency with choice today. And we're expanding and extending our contract with Acumen for common law self-direction. We're sharing information about the common law option with families. And once again, this is probably the safest option to avoid a disruption in your services. We're partnering with South Dakota Supporting Families Community of Practice to help families plan for summer, because we do know summertime is kind of one of those times that those companion care, respite care really get used quite a bit more. A lot of kids are out of school, and that's kind of those summertime hours are filled with those services. So we really are taking that and really looking at it closely. We're starting a new work group to partner with families and providers on solutions, which we will talk a little bit more on how you can be involved in that a little bit further in the slides. So if you have other ideas, put them in the chat. We'll gladly hear them, and all ideas are good ideas. So definitely share. So learning a little bit more about common law, the common law option for self-direction. So people receiving supports in their families can work with Acumen to self-direct their Family Support 360 services. So kind of just to get a little more detail on it. So the employer of record or common law option. So when a participant or family member or other chosen person acts as the employer of record, it's called common law. An employer of record has responsibilities such as completing registration paperwork with Acumen and tracking the time that the employee worked. In common law, you cannot be the employer and employee at the same time. If you want to be the employee, you need to find someone else to be the employer of record. This can be a family member or a family friend. While we are working hard to find new options, this is, once again, currently the safest option to avoid a disruption in services. So a little bit more about Acumen. Acumen provides support to people who choose common law. Acumen helps people file taxes, take care of other paperwork, and provides tools to help employers and employees track the time they work. Both employers of record and employees must enroll with Acumen to use common law. Acumen provides enrollment packets with all of the documentation that you'll need to complete. And kind of that first step is, if you are interested in Acumen, please reach out to your family support coordinator. They would be your first contact to help you start this enrollment process. So there are also some helpful videos online that provide information about how the enrollment works. So there are I don't know if Nick has it super readily available, but there are some training documents and training materials that he can provide a link for in the chat. So what does it mean to be an employer of record? The common law self-direction gives you a lot of choice, but it also kind of comes with maybe a little bit more work and some more responsibility. You are the employer of the workers you hire, but you also manage your own budget. So when you self-direct, you are the employer of record. That means there are certain things that are required. So developing your self-directed budget that fits within your approved individual budget, making sure you're not spending more than you budget, recruiting, hiring, and training your workers, and determining your workers' wage, then developing your workers' schedules and managing timesheets. Supervising and evaluating performance of your workers. You may also have to fire a worker if they're not doing a good job. So making sure that you have an emergency backup plan. So that plan will help you if a worker you hired cannot be there when you need them to be. Reporting any incidents of abuse, neglect, or exploitation, and then keeping records that are required to keep in a safe and secure place. So you will have support. You're really not alone in this journey if your family decides to choose the common law option. Your family support coordinator can help you understand the common law option. We are working with family support coordinators now to help them understand the program better. We're even meeting with them on a weekly basis, and we will actually today we'll be meeting with them right after this meeting. We do know that it is a new option. It's a new service option in South Dakota, and so it's kind of new. We're still kind of working through some of that, um, but your coordinator is definitely a very good option to start with. We're also exploring a new support called Support Broker. They are people who can help you understand the program, manage your budget, and manage your workers. We want to hear from families about what supports you think you may need and whether another person would help or maybe be more to would help or maybe be more to manage. The fiscal management service, which is Acumen, will pay your workers and help you with your taxes and employer insurance. And then there are also family members who are enrolling and doing self-direction with Acumen now who will share their stories and want to help. I do know with Acumen, that link that Nick provided at the bottom, there is a calling tree if you have questions specifically for them. So they do have some options there to contact them directly. So how you can learn more. The Division of Developmental Disabilities is working to create and distribute more resources. This is an ongoing endeavor. We just keep, as families are expressing need for certain items or certain documents, we're doing our best to keep up and to provide those resources. So here's kind of what is currently available. So on our website, and you can get to our website, even a quick Google search of South Dakota Division of Developmental Disabilities will get you to our website. Under the DD highlights, there's an agency with choice, information, and updates. So this is where you're going to find the most up-to-date information on agency with choice. So some of the things that are located there would be when the town hall meetings are going to be held. There is an excellent FAQ document out there. So from some of our frequently asked questions. So in the previous town halls, the questions were gathered and an FAQ document was created for those. There's also more information about common law. It has, once again, the training materials for Acumen, the website for Acumen, and just kind of some comparisons of common law versus agency with choice. This is also where there's some more information on shared living as well as a potential option. So that's also another good resource. So the new FAQ. So we posted answers to the questions we heard in last month's town hall, and we'll do the same for this round of town halls. So we're trying to get as much information as we can in this document, where it is fairly organized. So you should be able to locate, the questions or kind of what they're related to pretty quickly, and it's pretty user friendly. So it's a very good very good resource for families. So kind of the next step is it's kind of what's next. I think one of the things that we always struggle with is our families and individuals staying engaged throughout the process. More often than not, we see, start strong and then it kind of tails off a little bit. So we would really like to have all the families stay as engaged as they can throughout the process. So that way we can really partner with you to try to find solutions to some of these concerns. So one of the ways that you can do this is joining our work group. A new work group for individuals and family members about agency with choice is being created. If you are interested in participating, please email ddd.update@state.sd.us. Talk to your family support coordinator. The state meets with family support coordinators weekly. We give them information about agency with choice and answer their questions. You should talk to their family support coordinator about how your services might be impacted. They're really the front line and our direct contact with families, and they're very knowledgeable about these services. So routinely check the website. This is probably where the most updated information is going to be. So it has updates and resources will be there as we get them. So bookmark the page and visit it as frequently as you can, just to stay as up to date as you can. So check your email. We are sending emails to individuals and families about these changes. If we have your email address, an email was sent to you on March 21st, which was last Thursday. There is an option to kind of get added to the emails we send. So we do have a listserv that is located on our website. The link for it is right kind of in the slide, and we can definitely drop it in the chat as well. But it's also kind of another one of those that's located under DDD highlights. And so the listserv is located there. So please join that if you're able. So if you didn't see an email, if you don't use email, please check with your family support coordinator. They also did get a copy of the letter as well. The next option would be surveys. So there's 2 surveys, one for participants and families, and then one for staff and caregivers. These are being sent out by email this week. So please complete a survey to share your feedback and questions. Look for information about an upcoming waiver amendment. So we do have to amend the Family Support 360 waiver to reflect the changes that are going to be occurring with agency with choice. We'll share those changes as they come, and then we'll also be seeking your feedback on those changes. So now we're kind of getting into the question section. We wanted to leave as much time as we could for individuals that had questions. That is really one of the biggest points of these town halls, is for you to be able to ask your questions. So we know this is a really big change, so we'll kind of just jump into them. So we'll kind of just open it up for self-advocate and family questions on the work the department is doing to develop solutions. And if you do have a question, it's okay. I want everyone to feel as comfortable as possible. There's no silly questions at all. So just if you have one right now is a good time to ask. So I'm just any question at all that you guys have we would gladly try to answer. We don't need to go in this order. Just so any question that you guys have would be great. And then there's also the option, to if you want to ask your questions anonymously, there is the QR code um, there as well, or you can go to menti.com and use the code there at the bottom of the screen to ask your question that route as well.
And Kate, we do have that open in the background and are checking for responses there.
Excellent, excellent.
Looks like we have our first question, Kate, in the chat.
All right. So the next one would be, I have heard that there are different requirements to be a companion care provider within the common law option versus Family Support 360. Is this true? If so, please explain the requirements. There really should not be any additional requirements that go with that. I'm not sure exactly if there's specifics on it or specific pieces of it that you're looking for an answer on or clarification on. No, there really shouldn't be any additional training requirements for companion care.
This is Carrie. I would just jump in and just share that, it's the exact same. The waiver is the waiver, waiver requirements as far as age and all of those requirements. Nothing's changed with the waiver. It's just how those services are delivered. And so that employee of record is really the biggest change. And so as you are moving, as somebody who has moved to Acumen, the paperwork looks almost exactly the same as any other paperwork, with the exception of that the SS form. I'm not good with numbers or attention to detail, but the form that requires, the tax information. That really is the biggest difference from when our companion care, respite care, personal care providers have joined on to some of our agency with choice model. So that's the good news, is it's not much different as far as the requirements of paperwork. And then, certainly the way you provide the service looks exactly the same. So the family members train the individual to work with the participant.
Yeah. Thanks for that,
And
Carrie.
then just to piggyback off of that as well, Acumen doesn't necessarily require any training in terms of using our systems. We do require you to use the systems. So there's some element of like learning how to use those DCI time entry systems. So I guess there is an element of training, but it's not required. We have videos available online. You can watch them, at your own pace. I'm going to go ahead and repost that link in the chat box for everybody now. Hopefully I don't lose too many questions for you guys, but in terms of Acumen's training requirements, quote unquote, that third video listed there on that page would be your time entry training and things like that you would kind
of. Thanks for that, Nick. So for the next question is, as the other agencies are going until the end of the year, what could be done to possibly have LifeQuest extend the services until the end of the year also? Well, nothing's final. We are still talking with LifeQuest, kind of exploring some different options that may be possible there. So we are definitely still in communication with them and, just trying to find solutions. Is there going to be any other choice than common law? We are working with a South Dakota provider for agency with choice. So that is, we are currently working on that. We're also exploring national agency with choice providers as well. And I think we will always kind of keep an open mind on other common law providers. So it's right now we're just kind of exploring all options. And so in the future, there likely will be more. But right at this point, Acumen with common law is the safest, most secure option. So what is the time estimate to get up and running with Acumen? I think we've had a few recently come through. I think for them, it was roughly 3 weeks is about how long it took. So that's kind of what you could likely expect. If there are delays in paperwork, then it can take a little bit longer. Uh, but the last ones we've kind of had come through, within the last month have taken about 3 weeks.
I can just throw out there one way to speed up that process is watching the enrollment packet guide video. That goes through in detail every document that's required and kind of tells you what to fill out and where to sign. Making sure your paperwork is correct the very first time you send it in is going to be the biggest time saver in the entire enrollment.
Yep. And we have heard that from other family members as well, that, watching the training videos is beneficial, especially after kind of starting that enrollment process. Um, Definitely take the time to review those videos.
I have a question.
Yeah, go ahead, Amanda.
And it's mainly for Nick, and I'm going to try to explain it as easy as possible. But I had a family ask me this question. So say you have family number one, who dad is the employer and mom is the employee, but then you got family number two, and the employee for family number one wants to be the employer for family number two. Is that possible?
It is. Yeah, as long as there's no program rules against that, Acumen doesn't have any rules against that as well. They would use the same profile. And from a technical point of view, Acumen would set up their profile as an employee and as an employer for that other client number two. So short answer is yes, there's nothing wrong with that at all in terms of Acumen's process. I'll just let Kate kind of confirm from a program perspective that.
Yeah, as of right now, that's my understanding as well, that it is possible to do that.
Okay. And the reason she was asking was because there were so many people saying Acumen couldn't be utilized for them because they're a single parent and they couldn't find an employer. So that's why she asked that.
Yeah, and I think one thing families should really consider is, crisscrossing a little bit. I think that's a good option. So, one family can kind of utilize another family and they can kind of work together on it.
Yes. Thank you.
Mm-hmm.
Yeah, this is Carrie again. I'll just share that as a result of one of our town halls this week, two family members were sharing their stories and the frustration of, not being able to find an employer of record. And so those two families actually exchanged phone numbers this morning. And so they're going to work together to become each other's employer of record so that the new system can work for them. So that's kind of a yay for South Dakota teamwork and true picture of community, right? So if that's something that you know of other families that are struggling with and would like to explore that option, we'd be happy to get families connected.
Yeah, very good question, Amanda. So is there a way for a family to get signed up and approved for Acumen, but keep the agency with choice option for as long as possible? So you can't be on both at the same time. Now, I will have to clarify on whether, you can go through the enrollment process and not use it until, maybe agency with choice ends. I will need to clarify just a little bit on that particular part of it, but you can't be using both at the same time. When a family gets their good to go date, how long from that date does a worker have to provide a service?
I can help with that one.
Go ahead, Nick.
Yeah. Yeah, so the good to go date will be the actual start date. There are circumstances where maybe we will have a good to go date sent out today for a date earlier this week, like Monday or Tuesday, right? So that does happen from time to time, especially if we are a day or two in arrears for processing paperwork. and this can kind of piggyback off the other question as well in terms of utilizing agency with choice services for as long as possible. A lot of the dates that you enter in on the documents impact this, most notably the I-9 for the employee. There is a first date of employment listed there at the bottom of page 1 of the I-9. You can make that date as far in the future as you want, and we can make that the start date. But essentially, whenever you get your good to go date, that is the actual start date from when the employee can begin providing services through the Acumen systems. Whatever date we want that to be as a collective, right? If it's the date that you get us that final piece of the puzzle with paperwork or background checks, all that, or when we finally get the authorization from the program, if they want to future date that as well, we can certainly explore those options and work together there. But Acumen, if we give you a good to go date, that would be the actual start date of when the employee can begin providing services.
So the next question is, does the person who is the employer get compensation for all of their work? Right now, they do not. So that's kind of the short answer to that one. Believe that's all in the chat. So if anyone has any other questions, just unmute and go ahead and
I have one more question for Nick. So I have a family who's going to be the employer, and I have never seen the application yet that she's filling out, and the employee, she has the employee filling out the application too. I just wondered, what supporting documentation do you need besides those applications, like a driver's license, social security card? Is there anything else?
It's a great question. So in terms of requirements, Acumen doesn't necessarily require those types of documents to be stored with Acumen. However, being an employer of record means that the employer should store those, in a secure place, like copies of the driver's license and social security card, to match with the I-9. If employers do not want to manage that on their own, include those documents with the enrollment packet to Acumen, and we will store those on your behalf. Somebody needs to store those two specific documents, the I-9 and then the supporting documentation. So usually driver's license, social security card, sometimes passport or other documents. It just depends. Acumen is more than willing to store those and save those on your behalf, but somebody would need to if you don't want to send that to Acumen. So I think the easiest thing is to include those two forms of identification in the packet. But if somebody doesn't feel comfortable with that or they just don't want to, the employer would be required to store those somewhere in the home.
Okay, so the employer does not have any supporting documentation they need to send in besides the application.
Correct, unless there's any sort of like power of attorney documentation that they need to include. For the most part, the standard enrollment packet for the employer is all that we need for them.
Okay, thanks.
I got a question.
Yeah.
So and again, I'm probably showing my ignorance here, but if Acumen is taking over some of this system, and then benefits and that is, I'm correct here, then people will start getting benefits or having options to benefits. Is that right?
So I think a lot of times with being an employer, it's the number of employees that you have that really kind of triggers some of that requirement of benefits. There are certain pieces that Acumen does provide, and I can let Nick kind of speak to what they provide as kind of what they have.
I guess what my question is in relationship to that is that if there's added finances added on here, then when it comes down to developing a yearly budget with your coordinator, then is that going to be taken into consideration? If, let's say, somebody gets paid X amount of dollars an hour, but now they're going to have more money taken out of their check, then is that going to be negotiated then on the other end when it comes to when you're setting up wages?
That's a great question. And so short answer is, yeah, there are going to be taxes that are included with the hourly rate, right? So if somebody makes $10 an hour, they're also going to be, FICA FUTA SUTA taxes, workers' comp, things like that. So employees are covered by workers' comp coverage and with the Acumen program. And so that may be a new one that wasn't offered before. FICA FUTA SUTA taxes are pretty standard, but at the end of the day, all of that is going to be factored into the budget and the authorization. And so in terms of like updating the authorization, that would be with your family support coordinator. And those types of factors like taxes and workers' comp, all of that's going to be factored in. And so I don't know exactly what changes that might mean to your specific authorization, or if at all, but I do know that taxes and workers' comp is probably the one that's new. Employees have always been required to pay taxes in the past. So none of that comes out of your pocket as the employer. They do come out of like the overall budget.
One of the things that DHS has committed to follow up on this week during earlier listening sessions is to review our contract with Acumen and really get specifics so we can relay any impact that might have to the individual budget and clarify whether we are covering those costs or whether that impacts the individual budget. So we'll be following up on that and probably issuing that in an FAQ in the very near future.
So then just one follow-up question. Then I would still have the authority or whatever, or the agreement with my provider or with the support person, that we set the salary cap, or we set we like right now, we develop what the budget is, we develop what the hourly wage is. Is that going to still be the same, or then does that change?
And Nick, feel free to chime in, but yeah, that remains the same with common law. Mm-hmm.
Yeah.
Yeah. Acumen doesn't necessarily get involved with like developing that authorization or anything like that. We just take the numbers from family support coordinators. So if that's the person you're working with to develop and create that budget, that part stays the same for sure.
Okay.
Thank you for that question. It's a good one. So my husband and I are both caregivers in the care program for our son. We are allowed 20 hours each per week. If he becomes my employer through Acumen, can I work 40 hours to cover both of our care for our son? Yes, with Acumen, you can work up to 40 hours. So what are the advantages for a family to choose agency with choice versus the common law employer model?
Yeah, I'm happy to jump in here if it would
Yeah.
help. Having worked in a number of states that offer the different options might be helpful to give a little perspective. South Dakota is a little unusual in that it still has a very strong agency with choice program. What we see around the country is that most states offer the common law option, and it's really seen as the preferred option. It's actually called cash and carry. It's the closest way that states have to put as much power and authority in the hands of the people they support and their families. So when you think about common law, right, you have more control over your budget, your staff, their training, the hours they work, right? All of those things because you're the boss. Now, with that does come more responsibilities, right? Being the employer of record. And so that is the downside to that. Agency with choice, right? I think here in South Dakota has operated a little differently than it has in other parts of the country. And so there's been a lot of those common law features around choice and control in the way that agency with choice is operating here. And you've had the benefit of having those providers also help you, right? Review your records, make sure things are correct, and taking on some of those employer responsibilities. Now, what we see in many states, not all, who offer common law model is that they find ways to help families take on that extra responsibility. And so when Kid was sharing, what are we working on and what are some of the ways that you'll have help along the way? One of the things we're looking at is whether it makes sense to use a support broker model. A support broker is somebody who helps you self-direct. We know right now family support coordinators are already doing a lot of that, and it doesn't always help to have more people, right? Sometimes it's easier to have one trusted partner. And so one of the things that we've done is reached out to the families who are in the common law program now and self-directing and are setting up interviews to really understand what's been hard about it, where did they need help? Was working with their family support coordinator, did that work for them? Would they have liked to have more hands, to try and understand whether that's needed and would help here? Happy to take questions. I know that was a lot of information.
Okay. So I think the next question in chat is, can Medicaid or waiver funds be used to pay for employee benefits? And I don't know. I don't have the answer to that one, but I think there's someone on the call that probably does.
Yeah, I think, in the common law model, you can decide how you compensate your employees within a range, right? There are some boundaries and rules around that, but there are states where part of the way that people operate is to offer those benefits. It's usually pretty limited. What we have seen typically are things like some kind of contribution to health insurance or something that's done that way, or a way to pay for the criminal background check process, which I know the state offers here. It's pretty unusual to see it, but we have seen it in some options. And I don't know, Nick, if you have any experience with that so far with Acumen.
Yeah, I mean, the main benefit is the workers' comp coverage through Acumen. But in terms of like health coverage, I know California, some states have different laws. Like California has sick time requirements. But for the most part, they're, as you mentioned, they are pretty limited. And in terms of what Medicare waiver funds can be used for, that's a little bit out of my realm. But workers' comp is the main one that I think would be added, and I think would be a good benefit.
Yeah, absolutely.
And just to clarify, right, you're not paying that out of your pocket. It is paid for through the state's contract with Acumen, right? Like, so there are Medicaid matching funds that come in. So there's not the expectation that the person would have to pay out of their pocket or the family would. It would be covered through the state, either as part of sort of your individual budget, right, with an adjustment, or through a contract with the provider, Acumen. And then there would be federal participation that way.
Thank you. If we wanted to start a new hire on May 15th, what is the correct sequence of leaving LifeQuest and beginning with Acumen? So really your first step is going to be to reach out to your family support coordinator. There'll be just kind of a one-page information that you'll complete, and then they'll send it, your coordinator will send it to the state, who sends it to Acumen. That kind of really gets that process started. So that would kind of be your option on how to go about that. First step, family support coordinator.
I got another question. Let's say we decided to go with Acumen, and then, okay, LifeQuest is done the end of June, but then let's say October, another program has been established in the state that's more like agency of choice. I mean, now where are we? Because my understanding is to go with Acumen, we have to start that process all over again to apply for, am I right there? We have to submit.
Yep.
Okay. Yep. So now okay, we've been with Acumen for, let's say, 2, 3 months, and now this other program with Choice, now it's up and running. So then, I mean, then what? How is this all going to play out? I'm gathering that the state is going to bring something in. To me, maybe correct me if I'm wrong, but that not everybody's going to end up on Acumen, that there will be some other options. It's just not knowing the time frame. Is that right?
Yep. We're definitely working on other options right now. So kind of how if you switch to Acumen and then 3 months down the road, another option comes up and you would rather switch to that, you can definitely do that. It will be kind of starting over a little bit, but just kind of like a new employee type paperwork that would kind of go with that. But I mean, that is an option that you definitely can do. So you can definitely kind of just keep switching back and forth, but I think one of them eventually you'll find the right one and it will work. Next question is that would mean that you could potentially be on a waiting list, correct? There really wouldn't be a waiting list at this point for these services, for either using the common law option with Acumen, and the other option isn't available at this point, so it's kind of hard to say. I would not imagine, but I couldn't tell you for sure at this point.
And Tina, I think when I think about a waiting list, right, here the state's in a position where they know exactly how many people were using agency with choice. They know how many staff were engaged. And so, and there was already a way to fund and support people. And so it's relatively easy to make projections about what you need, right? And so that makes a waiting list unlikely. Now, look, if every single person on the same day submitted their application, would it take a little bit longer to process? Right, of course. And that's partly why we're suggesting that families who are looking at earlier end dates start sooner so that everybody's not at the very end trying to get in their paperwork at the last minute. But there's nothing that would have us anticipating a waiting list at this point.
The other question I have is, we went to all the meetings this summer about, what we want the future to look like, with family support. So where do all those goals and projections, I mean, where do they sit right now?
Do you remember what that was through, ma'am?
Well, Aaron presented
Okay.
all the families,
So I can speak a little bit to that. Our division, we've created an action plan based on the recommendations outlined in that report. And that report is available on our website. I can put the link in the chat here in a minute. And so we are making good progress. So we haven't stopped working on any of those goals. All of that is still in motion. We just had this kind of additional wrench thrown in that we didn't know about when those meetings were happening last summer. So we're doing this work in addition to all of the other work that we had already planned. Does that help answer your question?
Yeah. I'm just wondering how they're going to impact each other.
Yeah.
So
yeah, we're looking at that also, trying to make sure that we can kind of fishtail, whatever.
Yeah.
We want them to work together.
And for what it's worth, when I think about what were some of our quick win recommendations, there were things like partner with families, have meetings, at all different times of the day to be accessible. And, this is a good example of that, right? We've had lunchtime meetings in both Central and Mountain Time. There was an evening session that went for about 2.5 hours the other night. There's the family work group. And so I think, change takes time, but I see some of those quick wins starting to be used in the approach to solve this problem. And that's really promising. The other thing I'll drop in the chat is that the department has been updating the Family Support Council on their progress. And so the meeting minutes reflect the progress on the recommendations. And so I can drop a link to that in the chat here so folks can see it.
Okay.
Right. Any other questions out there? We just have a couple minutes left in the meeting. So if you have questions, there is the option to um, submit them anonymously too. Um, so that there's an option there as well. And we'll try to get all your questions answered in the FAQ document as well. So be looking for that. When will you know of your agency with choice option? I really couldn't give you a specific date on that. Not at this point. We're hoping sooner than later, but I do not have a specific date.
The answer is as soon as we do.
Well, everyone, I really appreciated you all joining. You guys had some really good questions today. So once again, thank you for taking time out of your day to join us here. But if you have, we'll stay on till 2 o'clock for sure. So if you have any questions, please, we'll stay on for a little bit. If you guys have any further questions. All right, everyone. I think we're about there. So thank you guys all for attending today. Really appreciate your time. We'll hope to see you again here soon.
Thanks, everyone.
Thanks.